Hello, everyone. Thank you for joining us. I'm John McCoy, Director of Alumni Relations, and I have here with me Mitchell Cole, who is one of the student representatives for the GPSA, and Anoy Padar, who is a student representative for the Alumni Medical Association. For today's program, our guest is Dr. Delphine Huang, and Delphine Huang is a medical director at IDEO in the Health Studio. She works closely with design teams to bring impactful and innovative ideas to life. Her projects span from devices to health systems to experience design. She is also a practicing emergency medicine physician at Zuckerberg General and Kaiser Permanente. And so today we're gonna have a session with Dr. Huang and explore her career. Both Mitchell and Anoy have questions for her. And then, but to get us started, the very first question, Dr. Huang, is how do you describe to others the work that you do and why you do it and why you enjoy it?
Thank you, John. I really appreciate it. It's so nice to be on this program with you guys. So a little bit about myself. I'm one of the medical directors at IDEO. I practice emergency medicine at San Francisco General and Kaiser. I don't know if you guys know much about IDEO, but just to tell you a little bit about our firm. We're a global design consulting firm. We span across 7 offices. And when people most think about IDEO, they think about kind of consumer products such as like the Apple mouse or household cleaning products such as OXO or steel case furniture. But we actually design everything from toys to school curriculums to financial services. And then even most recently in the 2020 election, we worked with LA County to help them with their voting booth and their voting system. So in terms of health, we work on product. We probably know a lot of the products that we've worked with. We've done work in insulin pens for Eli Lilly. We've designed the automatic defibrillators as well as laryngoscopes and wireless free breast pumps like the Willow. And our approach, we really take a design thinking approach process to our work. And a lot of times companies or organizations or foundations come to us because they have a really difficult question that they need help answering. And we user center and approach our work with empathy towards the user, and a lot of times in health, obviously that's the patient, the provider. And then we strive to really find innovative solutions that are feasible and viable. So I work on projects that span, like John said, all the way from medical devices to service design to improving patient experience to thinking about new ventures and startups. And I guide different teams as they launch into a new health space, get them up to speed about a particular disease, think about the stakeholders in the health ecosystems, and then help teams gut check their ideas with the reality and the complexities of our healthcare system. So that's a little bit about what I do.
Thank you for sharing. Mitchell and Anoy, do you have want to take the next question?
Sure, I can take the next question. So, Dr. Huang, you're working at IDEO, and also you're practicing emergency physician. What experiences influence the trajectory of your career today, and what strategies do you rely on for navigating your career?
Yeah, good question. I think emergency medicine and design, they have a lot of parallels. Both are collaborative, work a lot in teams, and they require a little bit of ingenuity when you're thinking about like limited resources. And both require you to hold the tension between ambiguity and being decisive on sometimes very little information. And that's how I think about design thinking. You may not have the exact answer per se off the bat. You actually, we start off with just the question and making sure we're asking the right questions. And then from there, we go through this process. So I think, emergency medicine is very similar, where a lot of times you see patients and you don't know what's going on with them. And it's really about, teasing apart trying to understand not just like the patient, what the words are saying, but their body language, their actions, their behaviors, to help better understand what their needs are.
For some of us, navigating our careers also holds a lot of uncertainty. And I was curious, like, what strategies have you used in terms of certain decision points and when you decided what to get involved in and where to go?
Yeah, I think, a couple things about that. I think that, with medicine, we're used to having, you go through, pre-med, then med school, then, you're in the PhD program, you go through PhD program, and then residency. And there's like kind of a clear path. And even that, there's a lot of decision points, no doubt. But it's kind of a clear path of like where you're going to go, especially if you're going to stay in academics. And I would say that if you decide to go outside of traditional clinical medicine, the path itself is not always charted. But I think thinking about being okay with riding out in the space where it's not well defined in your career path or clear is something that that is like actually that a lot of folks who don't go that go medicine route actually do. And so one of the things that I always for myself had 3 priorities. One I always thought about when I was thinking, hey, should I do this project or should I take on this new job is 1, does this make me happy? 2, does it give me a new skill? And 3, does it somehow feed/pay my bills, right? And if it didn't fit 2 of the 3 of those criteria, then I actually cut it out. Just because you only have a limited amount of time, you only have so much space that you can learn new skills, take on new knowledge. So I think thinking about, at least for me, those have that's the way I have used kind of a very short criteria about whether or not to work on something or not. But yeah, I think the very first point is that it's being comfortable with the uncharted path is something that we're not traditionally used to. And I think that's important.
I had a question about, going from in your daily life, you work in the emergency room, but then, there's times where you're working with this design team at IDEO. How are those teams different? And does that require for you kind of a mental shift, or is it just a natural kind of, are there commonalities between the 2 environments?
Yeah. Yeah, like I said, there's a lot of commonality in the sense that, in emergency medicine and in design, in our IDEO teams, we're really multidisciplinary. So like in emergency medicine, right, you have all your different fields that come in and help or work with you, that you work with, your ICU, your orthopedics. And in IDEO, we also have our teams are very diverse. Like we have, on a project, I can have someone who is a design researcher, interaction designer, a mechanical engineer, a data scientist, a business design person. And so, it's all these different perspectives that come in and they all carry different background experiences that then lend to the uniqueness of the ideas that come out. The other thing that I think is, when people ask like, how do I how do I come into this? How to be more creative? I mean, every one of us is really creative. That's innate in all of us. You may not necessarily see it in your day to day, but it's more about activating those creative problem solving skills, more intentionally and practicing it on a more daily basis. And so, at IDEO, I have the opportunity to do that. But, I imagine in medicine, we're always problem solving for our patients, for, a particular disease. It's about putting that jigsaw puzzle together. And so I think there are a lot of commonalities between the 2 in terms of what we do and then, how that translates to design and my everyday work.
Okay, yeah. So kind of tying back to the uncharted path to your present career, a couple of the registrants wanted to know like how exactly you found yourself in this position. One question that we have from the registrants is, why did you decide to take a year off during medical school to work at Agile MD? And why did you choose emergency medicine?
Yeah. Yeah. So in terms of, like obviously looking back, I'm like, oh, that made a lot of sense, like the path that I took. But at the time, it wasn't clear at all. And, in terms of when I first started as a med student and my decision to take a year off, I thought I would do the traditional thing of maybe doing some research, maybe doing some global health. And I was at a networking activity. I think it was, posted by UCSF, and I just happened to meet a co-founder at Agile MD, and we had a really awesome conversation. And we exchanged information, and I reached out to him and just was like, I'd love to hear more about Agile MD. And he was like, hey, let's talk more. And that led one thing to another. He's like, do you want to take a year off and work at my startup? And that wasn't on the that was not something I necessarily had planned for, but I was like, what do I have to lose at the end of the day? It's something different. It's something unique. If I hate it, I'll just go back and do the same research project that I was working on during medical school. And so, I think it's like those opportunities where, you have to, obviously, like I said, those priorities, like you got to figure out what are those priorities and how do you get to where you want to go. But sometimes taking a little bit of risk and being like, hey, like, maybe you do have the luxury of being able to take a year and take off a different path. And I think one of the things that I've learned, my husband's in business school, or went to business school. He's a product manager, and he switches jobs every 2 to 3 years, and that's like the natural par for like his circle of friends. Versus in medicine, I think a lot of us are thinking like, hey, like, how do we do this job for the next 10, 15, 20 years? And I think it's about getting a little bit outside of that mindset, that you don't have to find that perfect job. You don't have to find that, next step that's going to be that lifelong, because so many things change along the way that might change your decision and change your trajectory. So I think having that flexibility is important. The other thing is like, people ask like, how do I get into this space? I think, being persistent, don't give up, continue to network. Actually at IDEO, I actually interviewed and was rejected from IDEO as a medical student. And, at the time I was like, okay, like not for me. I'm going to go do residency, do some other stuff. But I always kept IDEO in the back of my head. And so when I decided to go do the Stanford Biodesign program, which I'm happy to talk about too, in that juncture, also same kind of thing. I was like, you know what? I have nothing to lose. If anything, it's like doing any other fellowship after residency. I might as well take a year off and see where it takes me. And if I hate it, then I'll go back to doing what I was doing before. And they had an externship that you could do in venture, you could do it at an incubator, and one of the options was to do it at IDEO. And so I did my externship there for 5 weeks, and then they happened to need more medical expertise, so then I stayed on as a consultant, and then that eventually converted to the director job. So you just never know. When I look back, it's like, oh, like I had interviewed as a medical student. Who would have known that, like, almost 8 years later, 10 years later, now I would be back at this job. So I think just always don't give up. If there's something that you're like passionate about or interested in, be persistent. There's always ways. And if it doesn't, even that specifically doesn't work out, other opportunities will come forward.
I think there were several questions sort of relating to different opportunities or experiences that UCSF trainees could expose themselves to have a similar sort of career or follow in your footsteps, and like the Stanford Biodesign program. So if you could talk more about that or other opportunities, I think people would be really interested.
Yeah, we had the benefit of being in Silicon Valley, which I think is, has just immense amount of opportunity. And as you guys know, like healthcare innovation is exploding, and it's not just devices, right? It's in service design, it's in building new systems, new technologies, informatics, right? Like there's so many opportunities in healthcare now, because healthcare is opening the doors to being receptive to new technologies. And so I think UCSF has a lot of opportunities in terms of part of the conferences that we have, like Rosamond Institute. There's also, I think, CB3. They all host networking opportunities where you have the chance to meet people outside of our walls, to be able to see what's out there. And I think, don't be afraid to set up an informational meeting. You'll be surprised. A lot of folks are very open to hearing about your experience and then also sharing their experience as well. I fully advocate. I guess we're in COVID times, but making those connections on LinkedIn, making those connections, just getting people's business cards, and then just sitting down with them for 30 minutes to have a conversation about their work. In terms of things that I think are really important when folks ask me like, hey, what else besides clinical medicine should I be focusing on? I think one is by far, what you carry is, as I think this crowd is primarily physicians, is you. So I'm just going to speak to that, is that, what you bring to the table is your clinical expertise. So by far, obviously I have friends who didn't necessarily finish medical school or didn't do residency. And that definitely is a path that you can take. But I think, one of the things that companies are looking for is that clinical expertise and also your clinical experience. The second thing is like when you are on, your wards or, doing your rotations, is to start understanding how hospital systems works, or how does the business of healthcare work? How does insurance work? Those are all other questions that, like, if you're going to work at a company or you're going to work with, with any client, right? The question that when we talk about an IDEO, when we talk about the three things that we need to do to be able to bring in ideas to be successful, it's desirability, feasibility, and viability, right? And so understanding the feasibility and viability is super important. Like, how does you're holding a catheter in your hand, like cardiac catheter or something, right? How does that product get into the hands of you, right? It went through multiple different steps to get into the hand of the user. So like understanding how hospitals purchase things, how does hospitals make decisions to stock particular medication? Those things are all like really useful information, and you get to be like firsthand knowledge experience because you're on the wards using that. So I would definitely say like, it's not necessarily you have to go and take a MBA or take a course. A lot of it's at your fingertips to learn. Talk to the nurses, talk to administrations about how they do the job, how they could do their job better. Asking those kinds of questions will help you understand the value of where technology could fit in.
Thank you for that response. I love the information. I love the information you share, especially about informational interviewing and how to go about exploring your interests. I know that health equity is a big part of your work and your personal what you bring to your work. Can you talk more about integrating that into your work, but also what role it played during your schooling, or how others who have health equity as a focus can integrate that throughout their schooling and then maybe their career?
Yeah, sure. I'm glad you brought up that question. I think, a lot of us come into medicine because, we have a social mission that we want to, bring better healthcare to our patients. And, the question of, access to care, equity in healthcare is something that I think is really important in innovation. I think, for me, I had worked at the General. I love working at the General, and like I have a soft spot for the patient population there. The community there has both has its challenges, but also just is a place where you can see the community really comes together in times of need. And so I think for me, one of the, that's what I want to give back. I think what's kind of interesting is, and so like in terms of what I did during residency and medical schools do a lot of work in care coordination and think about health systems design. At the time, I didn't know it was like health systems design, but thinking about like how can we improve the workflow, how can we improve the patient experience. Those are kind of projects that I worked on. And then, when I think now about health equity and innovation, I think it's challenging, right? Like, we want to get healthcare to, we want to bring the best healthcare to the people who need it the most. And, there are a lot of barriers to that, spreading from social determinants of health. But also, the levers when it comes to accessing healthcare are really challenging when you think about, the Medicaid population, what they're willing to reimburse. And then how does innovation come into that play when, if you're a business, you're thinking about what is my return on investment? How am I going to make a profit on this? When you think about how you're going to get reimbursed from Medicaid versus a commercial insurance, that can be really challenging. So it's something that I think healthcare right now is really struggling with. And I think it's the right time for innovation, but it is a challenge and something that is a passion of mine, thinking about how you can bring innovation to everyone and open that door is exciting. And so, some of both at IDEO and biodesign, we're thinking about how can we infuse the perspective equity across all aspects of our process, starting with like how we do our recruitment, how we do our needs finding, to thinking about how we do our when we do our concept generation, are we thinking about underserved population? Are we thinking about how they might be able to get the hands of this technology or the service into their particular hands? So, I mean, I think, it's a big question that healthcare is struggling with. I think there are a lot of structural issues that need to address that from the policy and from how we address it from a higher level. But in our day to day, I think thinking about when you're designing, you got to think about like, hey, am I being inclusive of everyone? Like, am I thinking about, the person that can't get transportation? Am I thinking about the person who may be visually challenged in this particular? That was something that we did a lot of work for example, in our work for IDEO when we did the voting booth. We had to think about all those aspects of like, if we want to increase the number of people voting, what are those barriers that prevent them from doing so, and how do we alleviate them? So same kind of thing can translate to the healthcare system.
Yeah, building off of current healthcare inequities, how has COVID-19 affected your work at IDEO?
It's interesting. I mean, I think it comes with its challenges where, for us, we do what is qualitative research. And, one of the things that we really love doing is, getting into the homes, into the workspaces of our users so that we can really see what they're doing. And it has, COVID has definitely brought in this new challenge where we can't necessarily do that. We've had to really move to remote. We had to get scrappy with the way we do our remote learning, how we do collaborative teamwork, right? So how do we brainstorm better on the video? How do we share ideas? Those are all things that we have been experimenting, trying. I think one with COVID is that, we have this opportunity now, like, before we would be like, okay, we'll go to 3 or 4 cities and that's where we'll target our research. Now we have the opportunity that I can go anywhere, right? I can talk to folks in the US, in another country, and get their ideas, with an hour conversation instead of having to fly there and have that conversation with them. So in some ways, it's definitely pushed the boundaries of how we think we can do our process and how we can do it better. It's also pushed how we do our prototyping, right? Like, I mean, now, like I recently worked on a laryngoscope project, and one of the things that we had to do was like, how are we going to do a laryngoscope project without like actually getting in front of our users? So we actually had to think ahead, like we're gonna build these prototypes, send them to our users, then we're gonna set up these videos where we're gonna be able to watch them and see how they utilize them, and think about the types of questions we're gonna ask them, so that we can still get the same good responses that we need to do good design work. But yeah, I mean, COVID has definitely made it more challenging, but has also opened a lot of doors. And I think that, we're seeing that in healthcare, right? Like healthcare is moving a lot into digital, seeing a lot of movement in telemedicine. COVID has pushed us to be like, hey, we don't need to do healthcare the way that we normally have done it, because we had to find these new ways to deliver care better. So that's exciting.
This may be a little more selfish question, but are there any practices your teams have discovered to make the online collaborative environment more engaging?
Yeah, so we use a slew of tools to make it to do collaboration. We use Google Slides on a regular basis for almost everything. It's, any of these, like, I think it's when you can type in real time and share in real time, that's great. You don't need to have any kind of fancy tool there. We literally just make little squares that look like Post-it notes, and then we stick them onto Google Slides and we work together. The other thing that we use a lot of, Miro and Mural, I guess, are the two other products that we use heavily online. And it has a little bit of a learning curve, but also equally great collaborative tool to use as a team. I think what's also unique is that before we would, be in person and we'd like draw or put things on the wall, but then that would be it. Now, what I think is kind of interesting is that because there's a digital footprint of that work, we're able to save a lot of that work and then translate that not just within a project, but then across projects in ways that we didn't, that we wouldn't be able to share in the past. So definitely play around with those tools. That's what we use. I think it works really well. And I think Zoom, it should not be seen as like a blocker. I think there's a lot of cool opportunities to do breakout rooms that, in ways that you normally didn't used to do, and make it fun. I think that's the other thing is that, a lot of these collaborative projects, it's really about, breaking the tension, being creative, Zoom, come up with fun backgrounds, come up with a fun icebreaker that you guys can do. That can really help unlock your team to be more collaborative together.
I just wanted to take a moment to see if there's, before we continue with our questions, to see if there are topics that you wanted to discuss with the students, or if there are things that we didn't hit on just yet.
No, the only thing I think I didn't answer, one question was about biodesign, in case that was something that people were interested in. So biodesign is a program at Stanford. They are a health tech, primarily focused more on devices, but they expanded into digital as well as, digital or software. So, but the idea behind there is that they, teach you about, it's a hands-on experiential program where you work in teams. I was on the team with an engineer, a CS person, and then a biomedical engineer, a computer scientist, an ICU doctor, and myself. And you do this needs finding where you start with you go out into the field, you do observations, you collect a bunch of needs, and then you start whittling down, try to figure out what ideas potentially have that viability, feasibility. But you're also learning about reimbursement, IP, regulatory pathways, and kind of how those might impact your ability to implement or succeed with a particular idea. So it's a great learning ground. It's a great learning environment for you if you don't have as much experience with kind of the business of healthcare. It also has a huge network within the Silicon Valley and beyond in this space. So it's, for me, that has opened a lot of doors and opportunities that normally wouldn't have been available had I not gone through that program. So just giving a plug for that. But, there are other programs very similar to this across the country that worth exploring as well.
Great. We do have a question from the audience, and this question is, how do you arrange the time to work as both medical director at IDEO, an emergency physician, Do you find it difficult to establish a sustainable work and life schedule?
That's a great question. So I think I mean, it's hard to speak from like, I came out of residency and then came straight into both IDEO. So obviously going from a resident schedule into an attending schedule, I'm like, this is great. And a lot less shifts than I was doing before. But I think, for me, I'm lucky because emergency medicine is shift work. And so it allows me, it permits me to be able to work almost a full week at IDEO. And then, I work a lot of swing shifts in the evenings and overnights in order to be able to do both. IDEO lets me do 80% of my work at IDEO, and then I have the one day off. And I still like to do the swing shifts in the evenings just because it allows me, for my own work-life balance with my two kids, more time with my kids. So, at the end of the day, it's about finding that balance of what is sustainable for you. If you find something you're like really passionate about, you're going to want to spend the time doing it. And that's like, I find now that I'm doing both the mixture of both clinical and IDEO, that mixture like is really fulfilling. So I don't mind putting in the hours. I try for myself I try to limit the number of weekends I work because I have my kids. I try to, like, on the weekdays, I try to be there in the mornings, for example, so that I can see them. And in the evenings, I tend to work more shifts. So it's everyone's balance is, you gotta find the right one. But for me, that's been fortunate. I do think it's challenging for folks that, I don't have a patient panel, or long-term relationship with patients. But I've met folks who are ICU doctors. I've met folks who are pulmonologists and surgeons, and they make it work. If that's something that you want to balance, you just have to figure out what that is. There's compromises on both ends. There's not a perfect answer to that, but yeah, it's an experimentation. Every year is different. Like I just had my second kid, and so I'm reevaluating my work-life balance all the time.
Congratulations, by the way, and thank you for sharing.
Yeah, that's great to hear. Speaking of reevaluating, where do you think you would see your career moving in the next 2, 3, 5 years?
Yeah, I mean, that's a great question. I mean, right now, I said like, hey, don't worry, you can switch jobs in 2, 3 years. I'm really happy at IDEO. I think it's a great fit for me. I'm learning a lot, the IDEO process. I have an opportunity to meet lots of different companies and teams. And so for me, probably it'll be probably a couple of years before I think of something new. That said, I still have a passion for health systems and thinking about what that looks like. I don't know whether it's like working at an innovation center at a health system, whether it's working at a startup that, does more like provider health plans, that kind of focus. I recently had a great conversation actually today with someone that works at City Blocks, and they are a provider health plan that that targets the underserved community. And, they're doing some really phenomenal work. And so, maybe that's something that I would pursue, but it's just like that, having those kind of informational conversations with folks, keeping back in mind what might be the future, kind of see where that takes you. So don't know where it goes. Same thing, kind of have to see what that uncharted path might look like. But yeah, I think being flexible, I think, is important, open-minded.
I'm just curious because I think I've been asked to make a 5-10 year plan. Did you do active exercises like that earlier in your training, and do you think it's gone the way you thought it would?
I think for me, the 5-10 years is too long. I think there's so much unpredictable decisions along the way. Whether it's, for me, it's like getting married, having kids, getting my dog, each of those things, COVID, it's hard to predict that far. So for me, it's about maybe 2 years out. and thinking about kind of like, what are the skills that I want to learn that I think could help me in the next 2 years or expand my knowledge in the next 2 years. For me right now, like spend a lot of time trying to understand deeper about the health systems and about insurers, we have a lot of pharma projects, so like understanding how pharma works. And so we didn't necessarily get that education in medical school. So, I think digging deeper into that is something I spend my time these days. Whether that translates to an opportunity in the future, hard to say. But that's the feeling that I'm like, maybe spend my time for. The other aspect is like health equity. Like, is there something there? I mean, you talk to a lot of venture folks, they'll be like, we wouldn't fund anything in that space. But then, like, for example, that woman I talked to at City Blocks, they just raised several millions of dollars in that space. So there is movement, right? So you just never know where that will go. But I think, you figure out, hey, in the next 2 years, I think these are the 2 to 3 things that really I would love to learn more about. And you spend your time educating yourself about it.
Earlier you mentioned when you're IDEO, not getting the IDEO, was it externship or internship, and then but revisiting with them. Is there, if you weren't doing like health design, biodesign, is there another aspect of healthcare or another industry that you think you would see yourself going towards?
Yeah, I mean, I hope that in the future that I can, or if I didn't do this, I thought about doing health administration, healthcare administration, and bringing innovation in that way. I think there's like a lot of awesome ways that you can be at a hospital and think about like bringing in new technology and new innovations. Anytime there's like a company that wants to implement their product, there's a lot of ways to think through, like, how is that going to get implemented? How are you going to test out that it's successful? And so I thought about being in that space. I think like I talked a little about the health equity part, like, how we're going to bring innovation to Medicaid, to our Medicaid populations. And so, I think that's something that I potentially might want to work in the future, and also continue to develop over the next few years. So yeah, maybe would have done that, or maybe we'll continue to do that moving forward.
And just not a follow-up question, but kind of so UCSF, all those schools, School of Nursing, Dentistry, Graduate Division, in your work in design, and do you come across other health professions or get a chance to interact with other health professions? And on a general basis, do you see opportunities for those other health professions and kind of where innovation, health design, and biodesign?
Yeah, I mean, there is a lot of movement right now. I'll give you an example. I'm working on a pharma project right now, and in the oncology space. And a lot of the work that we're doing is with the nurses. And then some of these nurses are part of this pharma company. Some of the nurses are obviously part of the health system. And so, I think there's a lot of interest in having nurses that have experience both in industry and also clinically participate in innovation, given that how involved they are in patient care. And so, yeah, I think there are a lot of opportunities there. There's a lot of movement at Google right now in radiology, for example, right? So, I mean, there are opportunities, I think, that potentially are there for other folks, for other care providers, and bringing that perspective and that experience. The other things to think about are, like, obviously we're exploding in terms of data informatics, right? So the folks that, I don't know if there are any folks on this call that are in, big data or CS, but, thinking about how data can translate is something that is huge right now, especially in the payer space. The last group I just want to throw out there, I think you guys talked about like other industries that might be worth exploring, is that we're seeing a lot of movement in terms of the non-traditional healthcare system. So, initially started off kind of like slightly outside of that would be like the One Medicals, the Virdas, the Omadas. But now we're starting to see like Walmart come into play, CVS. They all want to get in the healthcare, Apple, Google, right? Like all these players are trying to tap into healthcare. They're not traditional players. They need help thinking through the ecosystem of health of our U.S. healthcare system that's very complex. And whatever field, whatever care provider you are, you have that direct experience that you bring to the table. So yeah, definitely don't feel like you're limited just because of your particular training in any way.
Somewhat related. How do your colleagues at in emergency medicine or other departments in the hospital react to the fact when you tell them that you work at IDEO?
I think hopefully positively. I think people are excited to see people branching outside of the traditional academic medicine. I think a lot of folks will ask me, where do they see the future of healthcare? So it's fun to have those intellectual conversations, whether they think the new technologies are coming out. So I think that has been, I think, received positively. I think always a challenge at the end of the day. I think one of the questions for the panel is like, how do you balance between the two? And, as someone who just came out of the residency, I'm trying to balance, getting enough clinical experience under my belt and doing my other things I'm passionate about. And so I'm still finding that, I imagine when I talk to some of my friends my colleagues who are in the same level as me, who graduated the same year as me, who have been practicing clinical medicine full time, they probably are crushing it in medicine. And so I'm trying to equally just be a good doctor, hopefully a great doctor for my patients. But I'm very conscientious of the fact that, I don't practice full time. And so, making sure that I stay up on my medicine is a priority.
I guess one question I have is, how do you stay abreast of particularly what's happening in design, but also in healthcare? And I think, we recently did a program on how to amplify your voice as a healthcare provider, and so it's all around social media. So in keeping in that lens, like, who are you following, or what kind of resources are you taking in on a daily basis or weekly basis to keep an idea of what's going on in the two industries?
That's a great question. I would say I'm not doing the best job of any of those things. But I do try. I try to follow what's going on. I mean, equally as probably most folks here, follow what's going on in the news, follow up, stay abreast in terms of new technologies, kind of with the big players in healthcare. It's not, for me, it's also not just about like, who are the players, but where do we see the needs coming in? So, I love reading about, like Kaiser Family Foundation, like they network, they have like just a newsletter of like pain points for patients. I use that kind of as inspiration for new ideas. I do a lot of like one-on-ones where, I'll talk to folks at different companies, at different corporations, foundations, to kind of hear what people are struggling with, what have they heard, what are other companies that they're interested in. And I just keep a running list of folks that I'm like, hey, like this person has an interesting company that I just want to learn more about. And I'll just shoot them an email or LinkedIn and just ask them, hey, can I spend 15, 20 minutes learning more about what you do? So that's one way that I kind of keep track. There's no like one place that I check the news or anything, but I think it's, I just, when I hear something interesting as a company or a product, I just jot it down. And I keep a list of folks that I potentially want to contact, or in the future might be inspiration for one of my teams because they're working in a particular space that is fascinating.
Thank you for entertaining that question. Any final thoughts or any questions for us, or final thoughts that you want to share with the group?
Yeah, I mean, I would just say that, I think we talked about all of this before, is, don't feel like you have to, like, don't be afraid of the unknown out there if you want to take this path. I think there's just, there's actually a lot of people out there doing non-clinical work in healthcare who started off as a provider. And so, I think, definitely there are a lot of mentors out there. There's a lot of folks that you can ask questions. So definitely explore it. Keep your eyes out for job postings, things like that, internships. There are definitely those out there as well that you are worth. You may feel like, hey, I'm not qualified. Maybe I don't have like XYZ, but it's always worth applying. Because you never know. Every individual brings a unique background and experience that you may not know they're also looking for, or maybe there's not that job posting, but there's another job posting that they haven't, that they're looking for someone. So yeah, I do recommend just being comfortable with that ambiguity is something that's really important, and just really being open, like something that feels like you have like a gut feeling like maybe there's something there, then push at it a little bit more, explore it a little bit more, is what I would say.
That's great advice. We do have a question that came in. What advice do you have for trainees that are passionate about design but feel pressure to be productive through academic publications? You're kind of speaking about this, pushing against.
Yeah, I mean, I felt this as well, like, hey, like I'm an academic center, I need to publish. I think, I think you can tie it into the work that you're doing, like design thinking is just, or design in general, it's just a tool. It's a way to problem solve. So can you tie it into your papers? I mean, definitely. If you can do it, that's wonderful. The other thing is like idea of being productive during yeah, definitely in academic centers. If your dream is to become an academic professor, yeah, I mean, that's at the end of the day, that is the constraint. Like you have to publish papers to get grants, and also that's kind of the credence to academia. But even academic centers are becoming much more open to what does it mean to be an innovative innovative academic place. An example is like, I recently talked to some folks at Stanford, and they like, if you, for example, invent something, if you have patents, that counts actually towards your, like, I don't know, criteria for being an academic professor, right? So places are definitely stretching what they used to consider as, traditional academic physicians or providers, what qualifies for that. And so I would definitely, make sure that you're doing that paper because you want to be doing it, because you get something out of it. And if it doesn't feel like the right fit, then maybe it isn't the right fit to go down that path. And now that I'm outside of doing clinical medicine, nobody ever asked me all the papers I wrote in residency. But for other people, like I'll give you an example, like, like there might be folks at a startup that really having that deep expertise knowledge about, something about neurology, right? Like then you're going to want to be able to write that paper because you're going to be hired because you have that, vertical. It just depends on what you're passionate about. So just make sure that you're spending time doing the thing that matters to you.
One of the common themes I'm getting from what I'm receiving from our discussion is that it sounds like entrepreneurship is really big. Entrepreneurship, also innovation, is really big to probably what's been your drive in the things that you're doing. Would it be fair to say, and then maybe it sounds like also the future of medicine in this non-traditional environment is going to require practitioners who are willing to kind of innovate, take risks, or just operate outside of the norm. Is it fair to say that that group is going to, well, over time, that group will be bigger, a wider community and more support? So if you're feeling kind of out of the box now, maybe 10 to 20 years ago, 20 from in the future, that won't be the case.
Yeah, and I actually think they're out there now. You know, there are folks working even more so in industry than I am, you know, in the sense that they're working at, you know, a corp like J&J, Medtronic, you know, they're working at Google, Verily, they're there, you know. And so, you know, hearing about their path is can be inspirational. At the end of the day, it's about a leap of faith that, you know, if you decide to step outside of traditional academic medicine, that it's you're gonna be fine at the end of the day. I mean, I think you carry a well, all the folks I'm sure on this call, you guys are smart folks, that you guys are hard workers, and that you're creative at the end of the day to developing your own trajectory. So don't feel confined to feeling like, hey, I have to, like, you know, do this thing in order to do the next step. The other thing is just like also negotiate. I think that's something that we don't do well in medicine. We never like learned. We don't feel like we're entitled to do. I think, you know, negotiate for what you want to do as you get farther and farther outside of your training and you're, you know, taking on jobs. If you're like, hey, I really want to spend, you know, 1 day a week, 2 days a week working on X, bring that to the table. Don't be afraid to just voice it, and show that you're committed to working on this, right? So I think, you know, health systems realize that they themselves need to innovate. They're looking for new ideas, new thoughts. Remember, the innovation's not just like, hey, like a device or something. It is innovation is in everything that we do, in the QI project that you work on. It's in the survey that you created to like improve patient behavior or experience, right? That's all innovation at the end of the day. You're changing the way that we're delivering care. So, you know, I think be flexible with what that means, and then, you know, make the time for it by, you know, asking to, if making the time by asking and negotiating so that you can spend that time doing the thing that's important to you.
Thank you for that. I just have one last question, but before I ask that question, I will make sure Mitchell and Anoy, do you all have anything? And if not, it's okay also. Didn't want to be a hog.
I'm good on my end.
Okay. Yeah. So just to close out, well, just two things. So for our audience, the alumni relations team, I want to just promote that we have our own kind of UCSF LinkedIn type platform called UCSF Connect. It's a wonderful way both for alums and students to sign up, to share what they're doing career-wise, but particularly for students, if it's a wonderful way. There's a way in which on UCSF Connect, alums can say that they're interested in mentoring or interested in having an informational chat, and you can actually search that system for alums who hit that on their profile. So I want to encourage everyone to sign up on that site and check that out. And then for our guests, the very last question, and you answered this earlier, but I also just wanted to talk a little bit, talk just briefly in our last few minutes about mentoring, and not just about what that looks like, but, and you kind of said this earlier, but having I guess the motivation to, not just the motivation, but the courage to just make that connection. So to reach out, whether or not it's for a coffee chat or a half hour. Can you just talk more about how that was important in your career and getting past the fear of making that kind of outreach?
Yeah. So I can give you a roundabout way of like how I got connected to IDEO in some ways. Was that, I mean, I talked about the med school, but deeper into that story was, you know, I was doing research and how kind of health policy, health systems, care coordination. My mentor then connected me to someone at the DPH who was working kind of in that space and care coordination. We had a great conversation, and I brought it. She happened to be, she teaches a workshop in design thinking, and then she was like, "Hey, I know a medical director at IDEO. Do you want to talk to him?" And then I was like, "Sure." And so then that connected me to the person that was in my position at IDEO before me. Got in conversation with him. He was like, "Why don't you apply to biodesign?" That's what I did.
Nice.
And so I decided to apply, right? So it's like these little connections, you know, which actually started with my research project with my mentor, who was just like, "Hey, you know, why don't you talk to a few of these folks? This is what you're interested in." So I think sharing with your mentor what you're interested in and what you're passionate, you don't have to have a clear path, but just, you know, like, I think being open and vulnerable and sharing what you're hoping for, what you're struggling with, what you want, where you want to go, that can open a lot of doors for you, because those folks, they're a few years ahead of you. They have friends that are a few years ahead of them, you know, and they can help make the connections so that you can talk to folks. So you never know what one conversation would lead to another, but, you know, definitely take the opportunity. I think the other thing is, like, you get busy with medical school, and you're like, I got to focus on, you know, studying for this test, or like doing this paper or whatever. You know, I tried to carve out, like, maybe at least once every 2 weeks, a 30-minute informational meeting with somebody, just to learn more about the space. And I still do that to this day. So I think, and some of the people I talk to even now, I talk to students, I talk to grad students, I talk to entrepreneurs, I talk to people in corporations, CEOs. It's just a way for me to learn who's out there, because you never know, maybe that med student has a really great idea at the end of the day, so maybe it's worth talking to them. So I think just being open and making the time and the space in your calendar is important.
Well, thank you, Dr. Delphine Huang, for joining us. We really appreciate you for making the time and for sharing your advice, but in your career. Want to remind everyone that this will not be the only episode we'll do. We are looking at planning additional How I Became webinars with future guests. Please stay tuned to your various school newsletters for the next session. Thank you again.
Thank you. Bye.
Bye.